when we get our client in the supine position, we're faced with this quadricep group. The lower leg, yes, we have the tibialis anterior, and we have the peroneals on the inside, and so forth. Lower leg, you can address that supine and prone, whatever way you feel comfortable. We do know we have the bulk of the soft tissue in the prone position. I highly recommend treating the tibialis anterior in the supine position because you're able to use the tibia bone and guide your fingers, along that bone to create some separation. All right. But once we get up here with the quadricep group, due to the fact that we have a large muscle group and we only have the femur to compress against, there's some ways of treating it to get adequate pressure. You can go from the flat hand to the fist to the forearm, which gives you the deep pressure of that quadricep group. But outside of that, you are addressing mainly the mid portion of the quad, the rec fem. For some therapists, the isolation of this quadricep group from the VMO to the vastus lateralis really gets pretty tough to do during the treatment. So some of the things that I like to do once I'm faced with working this quad, and it just comes from angling the position of your client on the table. So one of the first things I like to do once I get to this lower portion of the quadricep group, obviously I locate that patella bone right here. But as I'm cuffing this area right here, I'm pressing down VMO vastus lateralis, and I'm kind of getting to that lower portion of the quad where there's a adequate amount of pressure, and the client should be able to feel that there's some work being done on that point. Once I warm up this area, and you'll see here, and I want to strictly focus on the VMO, simple technique, I can come here, make sure the draping is fine. I could hold my client's leg in this position, kind of like the figure 4, and now that gives me access to what muscle? The VMO. So I can get here and I can work this muscle group right here, and guess where that pressure, that counteractive pressure is coming from? The other hand. So I can get here, work this VMO, and give it some isolation with the treatment. I can go up a little bit higher. You okay with the pressure there? Mm-hmm. And if I have a client that's too big, I can just simply rest. Now I have 2 hands to do that treatment. So now I'm here and I can work this area, and if need be, come in a little bit deeper on this VMO. So that gives that muscle some isolation there. Again, I'm not putting strain on my lower back. I'm in the upright position. The table has to be low enough for you to get your leg on it. It's a higher table, obviously. You're probably better off just keeping it right here. All right? So, for the most part, I'm able to address that inner leg with the quad. But then guess what muscle group I have access to as I move in a little bit further? Your adductors. So the last time we talked about the hamstring prep, we were stressing the outer portion of the hamstring, but semimembranosus, semitendinosus is a muscle group, as you guys know, that comes in on that inner part of the leg, as well as with the adductor magnus, the gracilis, and all those other muscles. So now that I have this access to reach this adductor group, now I can come in a little bit closer to the inner thigh without causing any discomfort to my client. You okay over there, Jim?
Mm-hmm.
Where I'm not getting close to the private area and get a little, and where it gets a little kind of where they react to the pressure. So this allows me to get a little bit deeper, as you see here. And this is what a lot of therapists neglect, this inner thigh with their treatment, because they're so used to being in this position. Yes, they may come in here, but once your fingertips start to disappear, this is where we have an issue. So just by simply angling out this leg, making sure you have the tuck, you can hold or rest, gives you the option to get that adductor groove, finish off whether you're starting your hamstring work. Once you turn them around, now you can focus on the lateral aspect of the hamstring, but also get the inner quad muscle group. And now you're addressing this whole area from this position. And that's just a simple taking that leg from here and bringing it right here. As we address the middle portion of the quad, pretty simple. We know we have the femur to apply that pressure. No matter what technique you like to use, to get deeper, just make sure you're applying that pressure along that femur. Once you get to the top, obviously, your client's underwear will kind of let you know where to stop. You're going to roll off and come out laterally with that technique. All right. Now, in some cases, you want to start working this lateral portion of the leg where you got the IT band and vastus lateralis. I like to control, when I have my clients on the table, I like to use, the control of their limbs where I can angle it whatever way I need to do based on my treatment. So if I need to get this lateral leg, I can simply just internally rotate. This allows me to work this lateral leg. If you come around here, you'll see how I'm addressing that lateral leg. So I'm starting at the head of that fibula and I'm making my way up that lateral leg to address that IT band. It's a lot harder if I don't do that internal rotation because you see, I can't start at the head of the fibula. So just that simple technique here is allowing me to address that lateral leg. And I'm going all the way up, right up this IT band where now I'm getting ready to address this TFL and to get into this glute region. So just by simply doing this. Another technique, if you have a client that's a little bit more mobile, I can plant this heel on the table and simply do the same. Now look at the axis that I have. What muscle is this allowing me to address now? What do we have up here?
TFL.
Yep, TFL glute. So now, if you want to do a combination of internally rotating to get this strip, once you do a couple strokes of that, plant that heel. Now, is the pressure going to be a lot deeper? It's going to be a lot deeper. We got a little bit more pressure, right, Jimmy?
Mm-hmm.
But guess what I'm doing now? I got full compression of this IT band. So keep in mind, IT band is more fibrous, more dense than our regular soft tissues. So anytime we're addressing a dense connective tissue, we go a lot slower. So sometimes you'll see somebody do this quick technique on the IT band. This is something where you're just sitting on it. And if you get a little bit closer, you'll see the tissue. You can see that, right? Just following.
What is it? Tissue folding in on itself?
Yeah. All right. Again, make sure your client has the mobility for you to do that. This one you could always do. And this one feels good for the client as well, because opening up that joint area, you're getting some mobility in there. So here I'm addressing that. If I want to move up a lot higher and address this TFL, you do have options, prone or supine position. I like to work it a little bit better in that prone position, because the prone position allows me to pull this all the way up here instead of me tucking it with my thumb, and I'll show you guys that. All right. But I really wanted you guys to see how you could address the group, the quadricep as a group, and how to start to isolate. So you got 50, 60 minutes on the table. Client comes in with an issue, quad, and even tendonitis issue. You're going to address that. And once you get to the tendon, as you can see here, all I'm doing here, now that gives me access to work
the leg.
Yeah, to work on this tendon. So now I'm getting, you okay, Jimmy?
Mm-hmm.
So I'm in here, I have grip, and I'm working on that tendon here. All right. Last but not least, we're going to come back to tibialis anterior. You'll see here, it's the opposite foot, but you guys will get the point here. What I'm doing is I'm just using this border of the tibia, all right, and this is the outer portion here. And I'm just compressing along that border just to create some separation along that, with that tibialis anterior muscle. All right, we do have a ton of trigger points in the top portion. And then as we get down to the ankle, this structure down here, as you guys see here, then we got a bunch of little smaller bones, all right, and calcaneus bone and all of these structures down here, which allow us to get in and get some separation in that area. So what I'm doing here is one or two things to create separation. And I don't do anything too crazy on this area. I do one or two things. I'm either stripping it with the thumbs. I know I'm stopping right here because I can feel that head of the fibula. How we doing with the pressure? Is good? All right, that's the two thumbs. I can do the fist. But you'll notice I'm not doing this. See where the opposite hand is? So I have more stabilization here. I can do single. So the whole time I'm pressing against this tibia, because I know if I press against here, I'm going to create some separate, the tissue has to move. So I'm creating that separation along there. All right. Now, if I want to advance this technique as I'm stripping, all right, what am I doing now? I'm lengthening that tissue. But what's going on at the ankle? What is this? We got
Inversion.
Yep.
Eversion.
Eversion, inversion. We got that movement occurring. So as I'm coming up here. Choose to do it with the thumb, or if I choose to do it here. So I can create some movement as I'm stripping that muscle group. All right.